1. When an RBT collects data during a skill acquisition program, what is the primary goal? A. To prove the intervention is working. B. To document learner progress accurately. C. To evaluate the supervisor's methods. D. To satisfy regulatory requirements. 2. Which of the following best describes the importance of Inter-Observer Agreement, IOA, in RBT practice? A. It ensures data collection is unbiased and consistent. B. It guarantees client progress will be rapid. C. It reduces the amount of supervision needed. It replaces the need for operational definitions. 3. When teaching a client a new skill, the RBT should first ensure: A. The supervisor has provided written and verbal instructions. B. The client is fully motivated to participate. C. All possible reinforcers are eliminated. D. The skill is age-appropriate to test limits. 4. Which of the following is the most effective way for an RBT to provide feedback to a colleague? A. Offer criticism only after multiple mistakes. B. Provide timely, constructive, and respectful feedback. C. Avoid mentioning mistakes to maintain harmony. D. Use technical jargon to show expertise. 5. When implementing discrete trial training, DTT, the RBT should focus on: A. Prompting, reinforcement, and clear trials. B. Allowing the learner to choose every activity. C. Using unstructured teaching exclusively. D. Documenting only correct responses. 6. If an RBT is uncertain about how to apply a new behavior intervention plan, they should: A. Create their own interpretation of the plan. B. Ask the supervisor for clarification and guidance. C. Delay implementing until the client shows readiness. D. Apply general ABA principles without specifics. 7. Which of the following is an example of maintaining professional boundaries? A. Accepting small gifts from clients to show respect. B. Spending extra time with clients outside scheduled sessions. C. Keeping personal and professional relationships separate. D. Sharing personal experiences to build rapport. 8. The primary purpose of functional behavior assessment, FBA, is: A. To assign blame for problem behavior. B. To identify the function of behavior and guide interventions. C. To eliminate the need for teaching replacement behaviors. D. To compare one client's progress with another. 9. Which method is most effective for ensuring data reliability in RBT practice? A. Training staff to guess missing data. B. Using operational definitions and IOA checks. C. Collecting data only at the end of sessions. D. Allowing each staff member to use their own style. 10. When documenting session notes, the RBT must: A. Provide personal opinions about family dynamics. B. Record objective and observable information. Include predictions about future behaviors. D. Use vague language to protect confidentiality. 11. Which is an appropriate method of prompting during skill instruction? A. Physical guidance followed by fading. B. Repeating the instruction louder. C. Providing the answer directly. D. Ignoring errors until mastery. 12. If a client's progress stalls, the RBT should: A. Continue without changes for consistency. B. Modify the program independently. Collect accurate data and report to supervisor. D. Reduce reinforcement without approval. 13. Which of the following is a potential ethical violation by an RBT? A. Following the supervisor's written plan. B. Accepting a client's invitation to a family gathering. C. Collecting data according to protocols. D. Reporting unusual behavior to the BCBA. 14. What is the role of reinforcement in behavior change? A. To punish unwanted behavior. B. To increase the likelihood of desired behavior. C. To eliminate the need for prompts. D. To compare learners' progress. 15. A task analysis is best described as ... A. A list of reinforcers. B. A step-by-step breakdown of a skill. C. A data collection sheet. D. A type of functional assessment. 16. Which of the following ensures consistency in implementing a behavior plan? A. Using vague instructions. B. Fidelity checks and supervision. C. Allowing RBTs to improvise freely. D. Relying only on family reports. 17. When providing parent training support, an RBT should A. Deliver training independently without supervision. B. Use layman's terms and model strategies clearly. C. Replace the supervisor's recommendations. D. Avoid answering any questions. 18. What is the best way for an RBT to handle personal stress affecting performance? A. Share frustrations with clients. E. Request additional supervision or support. C. Reduce session length without approval. D. Ignore stress and continue as usual. 19. When graphing client data, the primary purpose is A. To make reports more appealing. E. To visually track progress and guide decisions. C. To satisfy regulatory requirements. D. To compare clients with one another. 20. Which of the following best defines extinction? A. Removing reinforcement to decrease behavior. B. Adding punishment to reduce behavior. C. Increasing reinforcement to strengthen behavior. D. Ignoring all client behavior. 21. When should an RBT use continuous measurement? A. When recording the frequency and duration of behavior. B. When observing only at random times. C. When data is not required for decision-making. D. When the behavior is rare and unpredictable. 22. Which of the following is an example of an operational definition? A. The client was disruptive. E. The client raised their hand and shouted. C. The client was bad. D. The client misbehaved often. 23. When assisting in staff training, an RBT should A. Provide hands-on modeling with supervisor approval. E. Create new training modules independently. C. Use technical terms only without examples. Avoid participation in training activities. 24. Which action demonstrates compliance with HIPAA regulations? A. Sharing data with other clients. E. Storing session notes securely and confidentially. C. Posting success stories online without permission. D. Discussing progress with friends. 25. When using a token economy system, the tokens function as A. Reinforcers themselves. B. Conditioned reinforcers exchanged for backup items. C. Punishers to reduce behavior. D. Neutral stimuli with no value. 26. If a client exhibits dangerous behavior, the RBT's first step should be A. Ensure safety of the client and others. B. Ignore the behavior completely. C. Implement punishment without approval. D. Stop data collection immediately. 27. Which teaching method emphasizes learning in natural contexts? A. Discrete trial training. B. Natural environment teaching. C. Task analysis. D. Errorless learning. 28. When fading prompts, the goal is A. To make the learner dependent on assistance. B. To increase independence and skill performance. C. To reduce reinforcement opportunities. D. To replace reinforcement with punishment. 29. Which of the following best demonstrates professional integrity? A. Reporting accurate data, even if progress is minimal. B. Adjusting data slightly to reflect expected outcomes. C. Avoiding difficult cases. D. Providing feedback only when positive. 30. Which of the following is an example of a motivating operation? A. Deprivation of access to a favorite toy. B. Recording data accurately. C. Using a fixed ratio reinforcement schedule. D. Presenting a discriminative stimulus. 31. During role-play training, the RBT should A. Provide immediate feedback after practice. B. Allow repeated errors without correction. C. Focus only on theoretical discussions. D. Avoid modeling desired behaviors. 32. Which reinforcement schedule produces high steady responding? A. Fixed interval. B. Variable ratio. C. Fixed ratio 1. D. Variable interval. 33. Which of the following is an example of generalization? A. A learner uses a new skill across settings and people. B. A learner masters a skill only in therapy sessions. C. A learner forgets a skill after reinforcement ends. D. A learner repeats a prompt exactly. 34. Which measurement system records if a behavior occurred at all during intervals? A. Partial interval recording. B. Whole interval recording. C. Momentary time sampling. D. Continuous measurement.